Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Jamie Pafford-Gresham, and she is the president and owner of Pafford Medical Services, and they serve Arkansas, Oklahoma, Mississippi, Louisiana. And she has over 40 years of experience in the emergency medical services realm. And she is currently president-elect of the American Ambulance Association and has served in numerous roles with state ambulance associations across numerous states. So Jamie, thank you so much for joining me today.
Well, Robin, thank you for having me. I look forward to talking all things ambulance with you today.
So tell me a little bit about Pafford, though, and what you guys do.
Yeah, not to date myself, but my family started our company in 1967 in Magnolia, Arkansas. So we have a family-owned and operated ambulance service, and this is whatever our 56th year in business. I don't know, I lose count, but it's a long time. And we joke, me and my brothers joke, we've heard the word ambulance every day of our lives. So it becomes very second nature to us to do what we do in today's realm. I do have two brothers that are in the business as well, and as well as my husband and my kids. So we're looking at the second and third generation of EMS providers.
And you guys branch out to a number of states. It's not just Arkansas, as I mentioned in your introduction.
Yeah. So we have services in Oklahoma, Louisiana, and Mississippi, and the U.S. Virgin Islands. We have some stuff there. Currently, Pafford has over 1,600 team members, and we operate in right around 90 locations in those 4 states, as well as have about 250 ambulances on the road. So I love to say that I'm a small rural ambulance provider, but I'm just in a whole lot of little places. But we have grown so much lately, especially in the Arkansas market. You see us in both Saline and Faulkner counties, which are very big markets, as well as Benton County now. And we're in 17 counties throughout the state.
Well, on that note, we hear a lot about rural healthcare and the struggles with smaller hospitals and how that affects emergency services as well. Are you seeing that in Arkansas and across the country?
Oh, absolutely. And the burden that it puts on the ambulance provider, most people don't realize because they think the hospital shuts down and then what happens? But just like using Lee County as the example, in I believe it was 83, their hospital shut down. And so they invested in their ambulance service because they did not any longer have the hospital facility. We really consider ourselves a healthcare safety net for so many communities that have lost their hospitals. That's that's the heartbeat of a lot of our rural communities is that facility. And when you lose it, then what do people depend on? And so what you see is, we have wonderful healthcare clinics in all of our communities and dedicated doctors and staff that are there, but they leave at 4:30 or 5 o'clock. When their day ends. And then that in turn puts that pressure on the ambulance provider because there's not anything else for a patient to do or a person to do when they have an emergency. They can't go into the ER, they can't go to the clinic, they're going to call 911 and ask for the ambulance. And so we're filling that void across so much of the service area in the United States right now with the closures of so many facilities. And the same way when hospitals close wings or different services and that patient has to be transported out to another facility because the services aren't available locally, that taxes the ambulance provider because they're used to taking care of the 911 in the community and not doing a lot of long distance transfers. So that hurts our system sometimes, but that care is needed just as much for that patient that needs to go to Little Rock as it is for the emergency that started. So.
And what do wait times look like? A lot of when you call 911, it's expected that it's fast, that they're there fast, but sometimes that's not the case.
Well, I think it all depends on where you're at in a community and in the county. How long will the ambulance take to get to me? Are they on a current call? In most communities, they only have limited resources, and it's the provider's job to make sure that they can get you an ambulance in a timely fashion. And so most people do that, and I have to tell you, you have to think of it this way. How long does it take you to get to Walmart or how long does it take you to get to town or to the local hospital, then you need to think that that ambulance also has to drive through that same traffic to come get you. I know, when you're in a larger metropolitan area, they may have more than one station, but in a rural community, there's most likely one ambulance station, and that's the area that they would be coming from. So, our goal is to respond immediately and safely to go get that patient.
And let's talk about the funding model to support rural emergency services. And are you seeing that as an issue? Is there a systematic funding model that works for both cities, counties, rural and urban areas?
So my first question would be, what funding model? Do you know something I don't? Because there's really not one. Ambulance providers and EMS itself is really in its infancy. Most people don't realize that we are suppliers of service and not providers of service. We don't do cost reporting. We're paid differently than hospitals are. And so we're a fee-for-service provider for the most part for a lot of our ambulance providers in the state, as well as a lot of private providers across the state. You have a wonderful service in MIMS that is a public utility model that has their tax base that they utilize that from. Then you go to Conway and you realize that they do not pay a subsidy for their ambulance service, but that the ambulance services that's there is a fee-for-service provider, and that's how they receive their funding. Woodruff County, Arkansas, they do a lot of work trying to come up with grants through our care in their county and trying to help subsidize that ambulance service with those grants, because there's not enough call volume to pay the payroll in that community or to buy additional equipment and things like that. So all ambulance providers right now are struggling for resources to find that revenue stream to help them at this point in time.
And not all states allocate supplemental funds toward those services, right? It's not just Arkansas.
Oh, no.
I mean, this goes wide.
It is nationwide. I think maybe what you're probably referring to is a lot of people like to talk about an ambulance being an essential service. And there's some discussion around the United States about, is an ambulance service an essential service like fire and police? And well, we're essential, but we're not categorized as that. And just with that title does not come funding. And so having that doesn't bring funding along with it. So what we're doing in the state right now is our Arkansas Ambulance Association is working with other folks to try to find that additional funding for the state, because it's obvious, we're a very small rural state, and in all 75 counties, we're blessed with wonderful ambulance providers that try to provide advanced life support care. And we've been able to do that. But we're hurting. We're a system that's hurting throughout the state, and we've got to find some funds to help those ambulance providers keep it at a top-notch level, and that quality of service be there in an expedited fashion, and that we're getting patients the care that they need, especially in these areas where we have had hospital closures or don't have a whole realm of services.
And EMS agencies typically don't receive insurance reimbursements. Is that correct? Unless the patient is taken to an emergency room?
We're only reimbursed at this point in time if we transport a patient. So everybody looks at us as a mechanism of transportation, but we're so much more than that. And during my presidency, that's one of the things that I intend to do, is to try to get the conversation away from my ride to the hospital to the healthcare that I received en route to the hospital. But we are only reimbursed currently if we transport a patient to the hospital. Probably 35% of what a provider does is respond to a call, and there is no transport there. But yet we check on the patient and they receive medical care of some sort, but they refuse transport. So those refusals are very, very costly in our market. And it's the cost of readiness, because we're not reimbursed for that. We were able to pass a piece of legislation with the help of Dr. Johnson, Representative Johnson from up at Fort Smith, to do a treatment in place bill this year that will make it be recognized when our providers provide treatment in place, as long as they're connected to a physician through telemedicine, that they will be able to be reimbursed for that. I know we're working closely with Medicaid right now at the state level to put this plan in place come January. And then all insurance companies actually have to cover it just as if it was an ambulance transport, an ambulance call. So we're headed in the right direction. Those are baby steps, but it's a big step for us.
It is. And EMS professionals, they are first responders. Would you classify them as healthcare providers as well?
Oh, absolutely. I think we get lost in what to call ourselves. And just as you struggled for wording about what do we call us, we talk about fire, police, and that other. When you have a politician at the podium trying to thank everyone, they always say fire, police, and oh yeah, those ambulance folks. But we are healthcare professionals. Our first responders are viewed, that's just such a large umbrella when you say first responder, but that truly is what we are. With that being said, absolutely, our paramedics go through, years of training, and they continually update themselves. And I think what I need folks to realize is, and from a hospital setting and from the community setting, what all a paramedic can actually do. I love to call them the Swiss Army knife of healthcare professionals because they can do so much. And it's just not the ride to the hospital. But we're seeing a turn in healthcare because we're not being able to treat that patient, not take the patient to the hospital, but more treat them on scene when they're not needed to go to a facility. If it's an emergency, you need to go to the hospital, you need to go to the hospital. But so many patients that we take to the hospital are discharged within 3 or 4 hours and didn't need to be there. And our healthcare professionals on the other side at the hospital, they realize they're backlogged. They have people waiting in the waiting room. We have people waiting on the wall. We are looking for space, and we don't need to clog the ER when that's not what's needed. So there is an opportunity for our EMS professionals across the state and across the nation to start doing more healthcare, not taking anything away from someone, but making sure that the patient is receiving what they need at the time they need it and not clogging up the system.
And in a lot of ways, they are the rural safety net for these communities in a lot of ways.
Oh, yeah. The healthcare safety net for the EMS provider just makes sure that when you call 911, you are receiving healthcare right at that moment. And the hospital may be 20 minutes away, but you're there at that moment, and that is the safety net. You don't have a hospital, you can't go into a clinic. We are the safety net holding up those communities.
And you touched on this a little bit, but tell me a little bit about what the policies are that you're advocating for. What is ahead? What's the dream in the future for Arkansas and for the rest of the country that you're working with?
Well, for my men and women on the street to be recognized for their skill set and not be considered an ambulance driver. That for people to understand that the ambulance ride is basically a part of the healthcare that you're receiving that day, and that you're being prepped for that physician and the nurses that you're about to go into that hospital with, because they are taking care of you just as if you were in the ER and sitting there waiting on that. So first and foremost, for the community itself, the medical community itself, to realize the value in the EMS professional that they have in their communities. And then the treatment in place legislation that we just passed was very, very important to that. And then two, for our administration from the state of Arkansas standpoint, and we will definitely work with them and continue to educate them on what struggles our ambulance providers have. And that really is, there's not call volume in our communities to help hold up the ambulance system across the state of Arkansas. So we have to find funding for all 75 counties to be able to have some type of grant opportunity for the county to tap into resources for the cost of readiness for those ambulance services. It'll help pay the payrolls, help buy the equipment. You can only buy so many ambulances. Everybody can give you a grant for an ambulance, but if you don't have anyone to drive it and you don't have the education behind it, it doesn't do anyone any good. So we have to be able to pay for those opportunities that we have in the communities to keep that healthcare safety net there. So that'll be fun. What it looks like, I think, is still under wraps, because we want to present that to the administration of what ideas we have. That's one thing. And then just as we move forward, working to have a great ambulance network in our state and be properly reimbursed. Another piece of our legislation this year was making sure that if we were an in-network provider, that we had a floor of what an insurance company could pay the ambulance provider and not be lowballed. We had actually had assistance with Arkansas Blue Cross Blue Shield with this legislation. We worked together to pass something that was, amicable for everyone. And then on the other side of that is having a piece of legislation that says if I'm an out-of-network ambulance provider, there is a limit of what you can pay me. And that floor was set as well. As I told you earlier, most ambulance providers do not have subsidies or other funding. So the fee for service, the fee we get for each and every ambulance call is important. And sometimes it may seem high to someone, but understanding what care you just received in the realm of which you got it in immediately and didn't have to go to the hospital, didn't have to get in your car, it came to you, that it is expensive and that insurance companies need to realize that.
So before we go, Jamie, I want to know, what do you want healthcare providers to know about the problem and how they can help change the conversation with their patients?
So I think first I would start with the provider, the ambulance provider, before I would start with the patient. And understanding what your ambulance provider can do for your patient is important. As we move forward in the months and years to come, you will see more healthcare being provided by an EMS service in their community with the assistance of physicians, some at home. The Hospitals Without Walls was a huge success. It ends in December. Where will it go from here? How can the ambulance provider play a role in that and help some of the smaller hospitals take care of this? There are opportunities out there for the ambulance provider to be a part and not just wait on that 911 call, but provide health care around the clock to our communities and be properly reimbursed in it to only strengthen that safety net that we have out there. So as we move forward, us educating, just like what we're doing today, thank you for the opportunity, educating people to the opportunities that the ambulance provider can provide for the physician, the hospital, the patient, and just be a part of that team. Everybody forgets about the ambulance provider until they get ready to call 911. And then they go, oh yeah, by the way, where's the ambulance? And at that moment in time, that's when someone thinks about it. And we're trying to prevent that and start having the conversation now and make sure the ambulance is included in the whole discussion, whether it's on mental health, how do we correct that? How can we help? We have a big, I don't mean to say a burden, but it is a big burden on the ambulance provider to use an advanced life support ambulance to take a patient from Hope, Arkansas to all the way to Jonesboro, or wherever a bed or a facility is available. So we need to find solutions, and we're working with different associations and different groups to come up with a solution just to that problem itself. So it's all about conversation and communication.
Well, Jamie, thank you so much for joining me today. And I've learned a lot, and I'm so appreciative of the advocacy and work that you're doing to make all of the emergency services for the rest of the state and for the country for the better, for the greater good. So thank you. I appreciate your time.
Well, thank you for having me.
And that's it for AFMC TV. Have a great day, and thanks for watching.